Some people diagnosed with COVID-19 get so sick that they need to be put on ventilators to help them breathe. Some studies suggest, though, that the mortality rate for people on ventilators can be as high as 90%. Is that really true? News 8's Shannon Handy spoke with a local expert today to verify.
90% is a scary statistic. Some experts believe the mortality rate for those on ventilators is actually much lower. A study conducted in Wuhan, China, the epicenter of COVID-19, found just 3 out of 22 ventilated patients survive, a mortality rate of 86%. In the UK, of 98 ventilated patients, 33 were discharged alive. The mortality rate there, 68%. And in the New York City area, one report released by the Journal of the American Medical Association found a mortality rate of 88%, though researchers later issued a clarification saying most ventilator patients in the study were still hospitalized, and the mortality rate was expected to come down as more results come in. The bottom line, the numbers vary. We can verify mortality rates in the 80% range, but that number only represents specific hospitals and areas.
That's not what we're seeing in San Diego.
Dr. Robert Owens, ICU medical director at UC San Diego Health, says the mortality rate he's seeing is closer to about 25%. He says rates differ based on various factors like age and underlying conditions and how prepared a hospital is. For example, early on, places like Italy and China became overwhelmed.
You had doctors and nurses who weren't used to taking care of patients on ventilators, trying to do so, and I think that's tough.
Another thing to consider, how mortality rates are calculated. Most COVID-19 patients are on a ventilator for days, even weeks, though some published studies didn't include those patients who may have survived. That's what happened in the New York study. So we can verify some of the numbers are misleading. Finally, there are medical options beyond ventilators that some hospitals like UCSD provide. One is a technology called ECMO, which oxygenates the blood. Dr. Owen says while the outcome isn't always one of survival, it's important to also highlight the ones that are.
We have had a 73-year-old man who was on the ventilator for 2 weeks and wasn't sure he'd make it. He's home with his family now and he's feeling great.
If there's an issue or a question you'd like us to look into, just email us at verify@kfmb.com.